My gosh, it's working. Hey, so I am going to totally mess this up. All right, guys, I am so sorry. I am on my phone now so that I am on my phone so that it works. So I am so sorry. So sorry. Hey, but I'm glad you're here. My name is Mandy. I am the birth nurse, and if you've ever heard any truths about labor inductions, I'm going to set the record straight today about whether they are true or not. And as a labor and delivery nurse, I hear a lot of them, like maybe all of them, but I've asked you some and I've gotten some questions. So let me run through my three that I think are really big. And if you are here and watching me live, thank you so much. Tell me where you are watching from. I would love to hear. I am at a Dunkin' Donuts in Virginia, and I want you to tell me at the top, like, where are you in your pregnancy journey? I heard on the other live that I messed up, that someone is due. Was it Genevieve that's having their baby tomorrow, or getting induced or due tomorrow, something like that. Hey guys, watching from home in Minnesota, Washington State. Hey Sarah. Hey Grace. Hey Genevieve. Yay, in California. Okay, that's awesome. Congratulations guys on your pregnancies and on your journeys. 30 weeks. Hey Sarah. So drop your questions about inductions. I will get to those, I promise. I have a few over here that I've compiled from questions and from things that just drive me nuts. So I'm going to run through those. If you're here, you know that, and you will believe and agree with me. Hey, oh, you're not pregnant, but you want to be educated. That's so great. You agree. Our bodies are powerful. With the right support, we are unstoppable. If you learned something, or if you're enjoying this, thank you for the likes. Thank you for sharing with pregnant people. That really helps my channel, and it helps me reach more people as well. So the first one, I call them truths and tricks, because not that someone is trying to trick you, but, and if you've been watching, you know, a lot of my content and a lot of my themes are turning to choice, voice, advocacy for yourself, your rights in childbirth, and the role that your labor nurse plays in that, because I am a labor nurse as well. So I don't think that people are tricking you. I think that a lot of times, your mindset in pregnancy is different as your pregnancy goes along. And later in pregnancy, or if there could be a possibility of shortening your pregnancy, or a possibility that something's going on with the baby, or a possibility that it might, then our mindset is altered because we are at the end of our pregnancy. So this isn't for everyone, and again, this is not medical advice, this is my opinion. But I do think that if things are presented, they often sound like a better idea when we're 39, 40, 41 weeks than when we're 29 weeks, okay? Because like the time is now for the baby to come out, and our discomforts, and our provider, when they say things to us, it sounds like maybe that's what is the right thing to do. Not necessarily always true. So the first truth versus trick. So I call it trick because sometimes it can be tricky to determine like what is the right answer. And also I think that a lot of times in childbirth in the US especially, but I know this, you aren't all in the US. In the US especially, in hospitals, which is what I mainly focus on, that's where most people give birth, is in hospitals. A lot of it is about convenience, because a hospital is a business. And when you have a business that relies on like policies and procedures and safety and a lot of unknowns and unpredictability with birth and with patient numbers and with staffing and money and insurance, there's all kinds of factors that play in that contribute to people offering things to you about an induction that can get really tricky and confusing. So I think that if your goal is convenience, then that's awesome. But if your goal if you've discussed with your provider that you don't want an induction, or you want to go intervention free or low intervention, or you don't want to do anything unless it's medically required, then it can get really tricky what is required. So that's why I call it truth or trick. We'll see how it goes. That may not be every Friday, but we'll see. How do you guys like it? Is it negative? I don't want it to be super negative. All right, do you want to go over? Do you just want to go over and meet your baby? Do you just want to go have your baby today? So that's the first one. And that is tricky. That is a that is a misconception that I have heard 1 million times. No, not 1 million, but I have heard that so many times. And labor nurses, can you relate to that? Have you heard your client come over from the office and be like, so what are we doing today? And your client, your new patient says, oh, my doctor offered that I could maybe just like come over and meet my baby today. And then it's almost like people are waiting for their baby to walk through the doors. That is tricky, and that is a trick. That is a total trick, because, and to be totally honest with you, when a medical provider knows more information than you do and doesn't tell you all of it, that is a trick. That is not okay. That is not cool. And plenty of providers that I know, that I love, have said things like that. And I'm like, why do you say that? Why do you make it so nonchalant? Why do you make it sound so easy? Because an induction can take days, even if you have a favorable cervix. We're not going to go through what a favorable cervix is. I talk a little bit about that in my class. Oh my God, comment of the day. What? Put in the comments right now what you hope is true about inductions. A lot of this is misconceptions, and some of it can sound really negative, or we're going to talk about negative things and like clear them up. What do you hope is positive? What do you hope is true? Put that in the comments. I want you to write that out and practice saying it so that it becomes true. Okay, so say it right now in the comments. Share it with us. We will like it. We will love you. We will give you all the love about it, and we will share our own. So what do you hope is true about inductions? What do you want to be true about your birth? Even if it's like, I don't want an induction, put that in there. Okay, make it happen. Make it true down in the comments. And scrolling down, you'll find like all the free stuff, but I'll talk about what that is in just a second. So do you want to go meet your baby? So yeah, that's not a thing. Like, some people have babies within the first day of being induced. Some people have babies within the first week of being induced. So it's a trick to say that you're going to go meet your baby today, or for someone to say, yeah, I think you'll have a baby today. Give me a like or a thumbs up if you've heard that before, because no one knows that. Even if, like, I've seen a person who's had other children before and a favorable cervix, their cervix not changed for a whole day. So that's not very fair to set up the expectation that you're going to meet your baby the same day as your induction. It's just not. Hey, I'm seeing some truths. Thanks. I love this. So planning your induction around when your doctor's on call, though. So let's talk about that. So say, like, you see your doctor in the office and they're like, okay, you're 4 centimeters. That's awesome. Do you want to be induced? Do you want to just be done with this? Have your baby, be done with this pregnancy. I'm going to be on call tomorrow. Why don't we do it tomorrow? So I get it. Like, I had the most convoluted schedule printed out, mapped out, planned out with my provider and my first baby, all the contingencies. I had backup providers because it was around, when was it? Summer vacation. She was going on a trip. And then my second baby, it was spring break. So I get it. I had my favorite nurse because she was my friend, and I was like, where are you going? Tell me your schedule. What is going to happen? I need you there. I get it. But guys, can we focus on the priority? The priority is, and the reality is, your provider might not be there. So if all of your eggs are in that provider's basket and that is your top priority, things are going to be affected by that priority. Like, there is going to be a ticking time clock on your induction. That means that your induction agents might need to be more aggressive. Like, would you start with something that softens your cervix, or would you go straight to maybe a balloon in case it works faster? Like, that's a lot of pressure on your body when it's not ready to go into labor right yet. And it's not ready to go in labor, and you know that because you're not in labor. And the baby has a lot to do with that, and we don't know all of the science that goes into labor. That's why we can't induce people very quickly. So we know your body's not ready. We're asking it to go into labor early. That's a lot of pressure to be like, we have to have this baby by the time my doctor leaves. Also, If you don't get that and your doctor doesn't stay or has to leave, or you can't have your provider, or your provider's there but busy in the operating room, and then you have another provider anyways, like there are so many things that can happen. Are you going to be devastated? Is that going to wreck your world? Because ultimately you could still have an amazing birth and that not happen. So I'm not saying that can't be your number one. If you've downloaded the birth plan template down below, you know it's not a checkbox, because I want you to come up with your number one. I give you like 3 or 4 slots for your number few, number 2, number 3, because if that is your number one, okay. But then that means you have to be okay with all of the things that come after it. Meaning, like, maybe you ask your nurse to be aggressive on your Pitocin. Maybe that means that your baby's heart rate drops a few times, and that's kind of scary. And that's kind of like, oh, I didn't know how that would feel when everyone runs in and tries to turn me. Or my baby's heart rate drops after an epidural because I've had a bunch of Pitocin going on and an epidural, and my blood pressure drops, and now they want to break my water. That's a lot. That's intense. If that is your goal, your number one is to have your doctor there, just go in with open eyes and knowing, which is the point of this: voice, choice, autonomy, empowerment, feeling confident in your decisions. Be confident that that's your decision. Be like, I knew this might happen. I want to be aggressive. I want to do this. I want to have a baby with this person. If that isn't your number one priority, then I really, really, really encourage you to bring the power that you have, the bravery that you have. Everything has to come from within and doesn't rely on somebody else. Okay? It doesn't rely on that one nurse or that one doctor or that one whatever, because you're going to have a lot of people that are on call. Your anesthesiologist, your nurse, maybe your doula, and maybe your family member has to drive in from out of town. Like, please don't put your eggs in one person's basket, because there are so many things that can happen with that one human being that is out of your control. And if that colors your birth experience, that can be kind of devastating. If the work that happens during pregnancy, your color comes from inside, your power, your bravery, your strength, your ability comes from within, then you have a lot more options. Then you can have a freaking amazing, blow your mind birth experience, because you've brought the tools inside, or your team has brought the tools. And so you can do it with whomever is there, even if it's the person that you don't want to be there. Okay? I challenge you. Even if you can let that, like, have a contingency plan for that, have a discussion with your nurse, bring someone who can advocate for you very verbally and vocally, whatever that looks like for you. That can come from within. That can be part of your toolbox. So that download is down below. If you've gotten it, let me know in the comments. What do you think? It's more of a brainstorming. It's not checkboxes. This is not a grocery list. This is a birth experience. We can't get it all and not have like the domino effect of other things happening with our number one. So check it out. See what you think about that. Let that help you get started from your power, your bravery coming from within. So download that template. That's free. Number 2, induction leads to cesarean. Have you guys ever heard that? Okay, so there are studies that show an induction has a higher potential for a cesarean. And then the ARRIVE trial. Nurses, thumbs up if you've heard of the ARRIVE trial. Comment below how you feel about that. The ARRIVE trial came out, I think it was 2 years ago, maybe 2 years ago, and kind of changed the game, changed everything. The study it showed, and it told providers that essentially you don't have to have a medical reason to induce at 39 weeks or beyond, because there is no greater risk for cesarean with an induction at that point. However, that study was not completely blind, and that study was not without faults. Also, that study had parameters. So when you have a scientific study, you guys know this, when you have a scientific study, there are rules within the study to be able to qualify. So that means that the hospitals, they were all in hospitals, they weren't birth centers. The hospitals had guidelines for what is early labor. How long do you allow early labor to happen, or cervical ripening to happen? And then what's next? And then what's next? And then how long is active labor? How long until a stalled active labor? How long is pushing? All right, all the parameters for when do you do a cesarean. When someone is watching you do your job, do you ever do your job any differently? I do. I mean, I try to have like kick-ass customer service every time, but if I know that I'm talking to someone in front of someone that's watching me do my job, if I just know that the person I'm talking to is watching me, that's one thing. If I know 3 other people are watching me, or it's all going to get written up, it's different. It's just different. In this study, it turned out to be better. Better when people were watching, better when it was a study, better when people knew, even if they didn't know their client's participation, they knew that they were going to be watched. These locations adjusted. They adjusted how their birth parameters were in an improved way. So I don't know if an induction for you is going to give you a higher chance for a cesarean. I do know it depends on your location of giving birth. And I do know that you can find this out, or at least get a little more information. You don't have to be pregnant to do it. You have to talk to your provider. You have to talk to your place of birth. Okay? Please get this conversation going. This is a lot about what I just posted in, it was an old live video. I can link it here on YouTube. I can link it down below on Facebook. Just posted it on Facebook, short and condensed version. And it was all about discussions with your provider. Guys, if we do not ask them, they do not have to know and tell us. Providers, hospitals, anyone. So if we ask them, what kind of guidelines do you have in your facility, or does this facility have, that mirrors the Arrive trial guidelines? And you don't have to know all of the names and words and numbers, but that does give you a clue for how long are they going to require cervical ripening. When do they call active labor, 4 centimeters versus 6 centimeters. Those kinds of things you want to know to see if your induction is going to lead to a higher risk for a cesarean. That's my opinion. And how their nurses and how their ancillary staff go about that. So what their rates are for inductions having cesarean. You can ask that. I don't know if they'll tell you. I don't know if they'll know, but that gives you an idea if your birth is going to be at higher risk for cesarean with an induction. And it still can be, and it still is in a lot of places. So that is not completely a misconception. That, guys, I'm having some Wi-Fi issues. So if this doesn't work, I will put it in a different video. I will link it down below. Okay, ways to induce are these misconceptions. Spicy foods, jumping or bouncing on a ball, trampoline, walking, sex, all of these things. Have you heard of these ways to induce? I did a video on it. I'll put it here if you're on YouTube. Tell me if you saw that video about inducing easy exercises to induce labor on a ball. But spicy foods, no, that does not make labor happen. For some people, they ate spicy food and then labor happened, but there's been no science behind that. So we don't know. We don't know what that is. That could be coincidence. Were you term? Were you about to have a baby? I have heard people, like some people say their water broke while they were eating spicy food, which is kind of crazy. Jumping or bouncing on a ball, no, but yes. Walking, maybe, but no. Okay, hear me out. This is why some of these are truths and some of these are tricks. I believe that, and you know I teach Spinning Babies parent class here in Roanoke, Virginia. It helps with movement strategies, techniques, exercises to do during pregnancy that help align your body and align your pelvis to give the baby more space to find their way to your cervix and start labor on its own. Oh, I've gotten a lot of amazing feedback on that. I have an email that was like, my labor happened so fast I couldn't even use Spinning Babies techniques in my labor, but I was using it in pregnancy. I haven't even read it. I'm so excited. I have to like sit down in a quiet place and like read it 3 times. I'm so excited. So yes, I think that activities that balance your body, like Spinning Babies things, the things that I teach in the class, the things that I teach here on YouTube, and the things that I teach in my Lamaze class online, are activities that can help your labor go into labor on your own when it's time. No, walking 5 miles is not going to put you into labor. If that were the case, you know, we would be going into labor early all the time, and it would help everyone. I think that a combination of things. So I don't think bouncing or jumping on a birth ball helps. I think using it during your pregnancy, along with other exercises to move your body, like sexy hip circles, to move your pelvis in different ways, helps. Balance your body, helps your baby go into the place deep in your pelvis or on your cervix or wherever they go to activate all of those hormones that start labor, I think that helps the baby find that spot around the time of your due time. Yes. So I think it helps, but there's a little caveat. So down in the description below, or if you're on Facebook, I'll link below 125 labor positions. Those are things you can practice. That's not the Spinning Babies parent class, but those are things you can practice to help move your pelvis, to help it respond in labor, and also to help now give a little bit more space. Move your joints into the bony pelvis in different ways that maybe you don't do regularly. When you're walking, do some sexy catwalk. Do some long strides. Be aware of how your foot lands on the pavement. Be aware of how your legs feel while you're walking, how your butt feels while it's walking, how your pelvis feels. Are you walking forward, or are you like wobbling back? Are you standing up straight, or are you like swinging and swaying? Be aware of how you're walking. That can help move your pelvis in a different way, stretch those soft tissues in a different way, which can help labor, but no, it won't put you into labor. That's a trick. They say go walking. That's a trick, but it's comfortable, and it can, adjust the baby a little bit, allow the baby to adjust herself or himself. But no, it's not going to make labor happen. Sorry. But this video, which I'll put here on YouTube, is the video for 4 easy birth ball exercises to induce labor, which I posted the other day. So if you haven't commented what you hope is true about inductions, what you hope is true about your birth, I love when we put truths down there in the comments. That means we're getting it out in the open, in the universe. Other people can comment. I want to know what you are focused on right now. So some of the questions, which I can't see on Instagram because I'm using my phone, because this Wi-Fi is dorky, I'm going to end. This is the end of my trying to be professional video. So thank you for the likes and the love. And I want to see you next week here for another live, maybe a trick or truth. We'll see. It might be about, I forget what it was about. It'll be good though, because it's something you guys asked for. So that'll be next week here, Friday, 12:30 Eastern. Does an induction mean an epidural? No, it doesn't mean, no, an induction doesn't mean an epidural. Does it mean that your labor will go a little bit more medically and mechanically than naturally, or more of a hands-off or let your own body do its thing approach? Absolutely. Do I think that Pitocin contractions are more painful than your own contractions? Absolutely. And I used to tell my clients and my patients, contractions are contractions, but I don't believe that. I heard that from other people, and I don't believe that anymore. One, I've gotten Pitocin, it hurts like hell. I turned it off. I don't say you should do that, but for me personally, I got it postpartum and I was like, oh, that hurts, slow that roll. My nurse was not super stoked because I didn't tell her, but I can relate. I agree that it hurts. I agree it's sometimes warranted, totally. And if you want it, it's warranted. I also know that it doesn't mean you're on Pitocin and it has to go a certain way. I think it can go up and down very fluidly. Not by you. Let your nurse do that. I was a terrible patient. Discuss it with your nurse. It means discussion. It means I feel like this is going too much. I feel like I can't get a breath. I feel like this is what's going on. And then hopefully you have an amazing, excellent, amazing, incredible trauma-informed nurse who can also discuss what they see, what they think might be happening, what they think are your options in this. But it can always go down. It can go down and it can go slower. But again, that comes from within. If you're okay with it going slower, if it's not, a medical emergency or an issue, that's just, it's tricky, man. It's tricky, you guys. So, yes, I think that they're more painful, but I don't think it's required that you get an epidural. I've definitely seen people have inductions that didn't get an epidural. Definitely. Okay. Hold on to that. But it meant that we were creative. It might mean that it's slower, or we turn things back and turn them back up, or we see what your body's doing without it. We do a lot of other things. It's very active. But no, you don't have to get an epidural with an induction. You definitely don't. People do it all the time. I'm trying to see where your comments are. Here we go. Absolutely possible to get through an induction without an epidural. I've done it. Yes, Julie. Yes. I don't want an induction. I hope labor starts on its own. Okay, castor oil is something that I include as a medication. I don't know a ton about. It's totally avoided in the hospital. I will tell you that right now. I've seen it make people have the most terrible shits ever. I've also seen it start a pretty fierce labor in people. I haven't used it. I don't think my friends have used it. If they've used it, they've been on like the hush hush, the DL for telling me because they know I'm medical, well, a nurse in a hospital. But I've seen people use it and get really uncomfortable and sometimes not start labor. It just really depends on what's going on with your body. A lot of things can help you like cross that line into labor, like stripping your membranes is an induction method, castor oil, but we don't know what's going on with your body, like kind of behind the scenes. So we don't know if it's going to like go right away or if it's going to take some time or more doses. I know people put castor oil in like shakes and things, but I truly recommend have help when you do that, and like either be in very close contact with your midwife, who is providing your care, and go with what they recommend, or your provider, be in contact with them. If they don't recommend it, but you're going to do it anyways, that doesn't mean you can't tell them what's going on. Okay, they're not going to stop taking care of you. If they stop taking care of you, that's like a human rights issue, and you can get care from a hospital. So if you do it at a hospital, like have someone be aware that you're doing it in case things do get out of hand and they do get really intense, and then you don't know what to do. I do encourage you to be verbal and vocal about that. So tell someone. But I know it can help some people. Any remedy to avoid severe pain from using Pitocin. So what Pitocin does is, okay, this is my opinion. I've seen it work. It's more of like giving active labor contractions no matter when in labor you are. And it's the goal is that it gives, and I mean, come on, it's a hospital. Like everyone gets the armband who's at risk. Everyone gets this policy, this protocol who has the hypertension, blah, 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 blah. That's how hospitals are safe. They have protocols. And so, hey, Amanda, the contractions are meant to be about the same, this many minutes apart. Okay, so your body's contractions are like, I want to throw in a big one. I want to throw in 3. I need to help the baby rotate. I don't know what is going on with the cervix. Here's what I'm going to do. A big one and then a little one. Or I'm going to have 5 and then we're going to have a break. Or you're going to balance and then the baby settles. And I'm like, I'm the uterus right now. I'm going to take a minute. I'm going to calm it down. I'm going to start up again in an hour. We don't know that. The uterus can't tell us that. But that's more of like your body's way of laboring. And Pitocin is like, no, like I only have one go. These are the contractions you're going to have. So that can be more intense. That can be harder to handle because that's not how our bodies were built to labor. But it can also help when needed. I would say have a discussion with the nurse on what your goals are. What are your goals? Are your goals to get through this unmedicated? Because that's not Pitocin's goals. Pitocin's goal is to give you contractions every 2 to 3 minutes, this strong, this long, until your baby comes out. So if that goal is different than that for you, discuss it with your nurse and be like, when my cervix starts changing, can we turn it down? I want to turn it down. I want you to turn it down here or at this point. See if my labor picks up on its own. You could do other things besides Pitocin. Like you could try all of the other things that could help labor start if you've already done that and need Pitocin or you want Pitocin. Doing the things that I talk about in my class, I talk about here on my channel about coping, like with rhythm and ritual, coping through your contractions. Evidence-based birth has good castor oil info. That's awesome. And a Birthful podcast. I freaking love Adriana on that Birthful podcast. So those are good places to get castor oil information. Thanks, Chelsea, for saying that. Yeah, I've heard it being used in desperate times, desperate measures. Pitocin is used very often, but again, for some people, only desperate times, desperate measures. I would bring a big toolbox full of ideas and know that you can do it, and bring people with you that trust you and trust birth and support you and support your goals. And so that may mean some creative ways of using Pitocin. That may mean breaking your water if you don't want Pitocin intensity. That might be something, but it's going to really depend on where you are, what's going on with you personally, and what your provider recommends for you and is willing to do. I would have that conversation super early and just know that there are creative ways to do it. But it might be a little more intense or a little different, but it's not totally impossible for everyone. I just know that it is intense. What about Pitocin after delivery? Is this needed? Oh, the flyest. Man, you're speaking my language. Is this needed? That totally depends on what's going on. But it is something that is given to everybody in this country, I believe, to most everybody, and something that is sometimes hung before discussed or given before discussed. I would have that conversation with your provider. It was shown that it can prevent possibly postpartum hemorrhages, which can be a very serious complication, very life-threatening. However, for you, is it needed? I don't know. So that can be a wait and see if you want to talk with your provider about that. That can be you don't want it, or that can be just do what everyone gets, which is a bag of Pitocin, generally postpartum, generally right away. I don't know if it's required. I can't tell you if it's required, but I don't think everyone needs it. I think that's what hospitals do to try to mitigate risk. Yeah, I do. I think that. And it does. It helps a lot of people, but I don't think it's required for everyone. What do you think? What have you guys heard about that? It shouldn't be unless there's bleeding. Well, I would, talk to your provider about that. See what they say. It's going to be probably at the bedside, and it's something that they're very used to giving, and they don't find a lot of side effects but I think that there should be more discussion around it. Personally, I'll do a whole video on it. I would love to. One for parents, one for nurses. But because it's a whole informed topic, like informed consent topic, I would love to discuss. But I can't tell you if it's going to be needed for you. I've had a lot of people say, keep it at the bedside, don't give it to me unless you have a discussion with me. I love that. Julie has had it with one, with not the other. Let's see if there's any more questions, because it's been 30 minutes. I love you guys for being with me and being here. This is so fun. And I'm at Dunkin', and their Wi-Fi is kind of working, except I'm going to have to change all of those links. And a little plug for my merch down below, which you can get. These questions, some of them came from Instagram stories, so thank you. If you are there, if you're not there, you follow me at Mandy Birth Nurse. The hospital will deliver has canceled all elective inductions currently, which I was happy about because they've been wanting to avoid a chemical induction. Oh, I like that word, chemical induction. So I can go till 42 weeks, which will be the 25th. Oh, Dana, that's good to know. Yeah, and this coronavirus, I've not done a video on that. I've been encouraged to, but I have not yet. If you guys want some opinions, I can do that maybe later this week. But hey, if you are out of the ability to go do your yoga class, or you can't go to your in-person birth class, then I'm going to consider figuring out how to do a Spinning Babies parent class online. But right now I have a full childbirth class online, which you can do in your living room. And I'm not having group classes right now, unfortunately. I was pretty sad about that. I can't get you like a rebozo. So I'll have maybe a discounted Spinning Babies parent class, because it won't be in person. I can't be hands-on, but we'll see if we can do that, how we can do that online. Let me know if you'd be interested in that. But my Lamaze class is down there, or we can just talk in person about your stuff, about your questions. I believe at our hospital, everyone gets PIT after birth. That might be because of how rural we are. No, Chelsea, I think most hospitals do that, or if not all hospitals do that. It's been recommended for years. And some things are recommended that they incorporate and some things not. Upright birth positions, moving in labor, going slow, 6 is the new 4. They haven't all incorporated that. Don't be hard on your hospital. They all do postpartum Pitocin. Really just depends on your body situation, everything else going on, whether it's needed or not, and how you react to it. Yeah, it meant, for me, the postpartum Pitocin was, this is totally off topic, but I guess we love talking about Pitocin. For me, it meant a lot more massage, which also was really uncomfortable. Even though my baby was latched, I did end up needing postpartum Pitocin, or I used a little bit of it. But I don't like to tell my stories because I don't want people to think like, oh, I'm going to do everything the same as Mandy, because I don't know what's right for you, but that was right for me, was to get a little bit, and then I just said, I don't want any more. And it worked. And I was being assessed by an amazing nurse. Sadly, in San Francisco, our volunteer doula program is closed. God, that sucks, Amanda. I'm so sorry. All right, so if you guys need to talk to someone about your birth plan, oh, hey, Kimberly, your message was retracted. If you want to discuss fears, I didn't even touch on that about inductions, but getting your toolbox ready and your fears out of the way, I think are enormous for labor starting on its own. Freaking enormous. That is the truth. So if you want help with that, I can help you with that one-on-one. We can do it online through Zoom. Spinning Babies class online would be great. Okay, Sarah, I will give it a go. Oh my gosh, you just put a million things on my plate. Also, I have a team member now. Can you believe that? Her name is Mackenzie. She's working right now while I'm doing this. Online, baby, no coronavirus. I've started acupuncture induction as a natural way to give my body a little encouragement. I love that, Dana. So you guys, I love that we are including a variety of things to help your body get ready and to help you feel what is going on with your body, because that's super wild. That's super wild. We don't practice that a lot. We're not that great at it, a lot of us. Me, who had trauma in their body, I'm not great at listening to my body. But using a variety of methods to help your body be as productive and efficient as possible, help your baby have the most space, get out all that fear out of the way. We're using our joints and our pelvis and in our body to be responsive and to be the most efficient that it can be by moving, acupuncture, having support, not being afraid. I think a lot of people get to like their 39th week and they're like, just get this baby out of me, and they're holding on to a lot of stuff still. And I don't think that's 100% why we go into labor, but I think that's a big part of it. And I've seen it like completely turn around, even right at the beginning of labor when we discuss fear, like sticking points. So I want to reach people before in their pregnancy so they can enjoy that last part of pregnancy, not feel that pressure to get the baby out so they can just be done and really get some great sleep and have this like weight off of them for all of those worries and wonders and fears. I'm scrolling up for some. My priority is always that we talk through the next steps as long as there's no immediate emergency. My husband and I are both a part of the decision-making process. Yeah, I love that. That way, when you have your baby, you can at least know. Oh, Stephanie's talking about knowing the on-call doctor and prepare for who's there. Yeah, I like that. I was induced with my misoprostol instead of Pitocin. 1 dose of oral misoprostol. My contractions started within 2 hours and everything went naturally from there. Geez, Nicole. I think also we're cousins. I had your last name. That is amazing. That is awesome. That is exactly what I mean by like, we don't know what's going on in our body, but maybe one little tweak will help us. And then with time and being patient might help your body to get kick-started. I don't know if it's related. Hey, Genevieve. But are there women who just can't go into labor naturally and have to always be induced? With baby number 1, my water broke, but labor didn't start for 24 hours, so my midwife suggested. Okay, Genevieve, I don't know the numbers for that or studies, but I have read some studies about your water breaking before labor, and I don't think it's impossible for a lot of people, but it may be. Totally. Your water breaking before labor is a unique thing. And it's not incredibly, like it happens, it's not incredibly common, as common as we think by watching TV and movies, which show it all the time. But I think that's a unique situation that yeah, requires a lot of different support. And I think it requires like planning in pregnancy, a lot of planning in pregnancy to have your baby in the right place, kind of anticipating that your water might break earlier than labor and that there is a time clock then at that point. It doesn't necessarily have to be like within 6 hours, but they do, most people within 24 go into labor and have their baby. And then the ones that don't need support. So I would, those people, if I can reach them in pregnancy, I recommend daily activities like the daily essentials with Spinning Babies parent class. I recommend sometimes, like if they think that they're going to need more, going to a bodywork professional like chiropractor, prenatal massage, just to help get all of the tools that you can to help your baby get into that great position for birth, so that labor can start, those contractions can start, and then having a lot of support once your water does break, so that you're kind of like actively managing. Even if you're resting, you are working with someone to help give you ideas and support for that active management of trying to get labor started. But that's awesome that you're doing that. That's a great comment. I've done it throughout my pregnancy, and I did it with my first Sarah. Oh, acupuncture really helped me, and I use massage therapy each week. Awesome. You guys are amazing. I am so lucky to be able to hang out with you guys every week. Thank you for being here, for supporting me, for supporting the birth nurse. Thank you for watching all the way through. It really helps my channel, it really helps my business. Also, any merch, if you get a sticker or a shirt, there's no shirts right now, posters or mugs, take a picture, tag me, either Instagram, Facebook, Mandy Birth Nurse. I want to see where they are. I want to see where those strong people, strong mama, strong birthing people show up. I appreciate your support and love so much. This has been 40 minutes. This is hella long, but I think we had a good talk. I hope you learned something. If you did, put it down below. I hope you've met someone. If you did, keep the discussion going in the comments. I love that. Definitely answer the comment of the day, and I will pin that at the top. You have been wonderful. Thank you for adding to this discussion, and I hope what I brought to it was helpful for you. If you want to be a part of next week's discussion, check out my Instagram stories during the week next week. You will find some comments for some questions. I will be at my house so that it will work the first time, and I'm so sorry about the confusion and the delay. I appreciate your time, and I do respect it. I tried so hard for that to work. So thank you so much. Check out the freebies below. Get started on your Birth Boldly birth plan template. That is brand new. And then 125 labor positions to rock your birth. I will see all of you beautiful people next week. Bye.